Medial side of your knee on the 9th of April. We're just looking at the medial side of the femur here. We can see here a little bit of synovitis, little extra bits called an osteophyte, little chunky bit of bone there, and that tells us that there is a bit of wear and tear within the knee. And you can see quite a soft osteophyte. That little bit of bone breaks off, so it hasn't really been there for too long. But we'll take these little bits out. We can see here the medial femoral condyle, and we can see again some damage over the medial femoral condyle here, and we'll just trim and tidy that up with a little shaver a bit later on and see if there is any significant damage there. So that unfortunately shows osteophytes, synovitis, and I suspect a bit of wear and tear under there. It doesn't look like there's anything down to bone just yet. Top of the shin bone here, we can see again a little divot here, a little bit taken out the back there. Little bit of damage on the end of the thigh bone just here, and we'll just trim up some of those little raggedy bits, and then the medial meniscus coming from here into the center of the knee, and that actually looks pretty good. So from the medial meniscus point of view, I think there's no obvious tear. We'll take a picture of that meniscus. I can't find a significant tear that goes right the way through to the back of the knee. Back over here, and that also looks normal. So we'll take the shaver, we'll clear out some of the bits of debris, see what we've got. The kneecap shows a little bit of wear and tear, nothing too awful, but quite bad down the groove of the thigh bone, so we're just going to trim some of those shiny surfaces on the medial femur, which are just there. So at the posterior aspect, that's probably grade 3, not quite down to bone. We'll give that a little probe in a mo. There we are, so there is some wear and tear, sort of mildly non-articular area, so not too bad. And then these little osteophytes and things around the side here, and we'll just hoover those off. There we are, so just get a little shaver in. That's that little bit that we knocked off earlier. So little bits of wear and tear. Nothing too bad. Maybe partial thickness wear, you can see there, little splits. So maybe 50% worn on the end of the medial femur. So we'll just take the probe and have a look at that. Actually, has that bit of bone, we'll just take that out. Just drop down into the knee. There we are. Up the hoover. Nothing too bad across there. Thanks. So a little bit of tear, wear on here, not down to bone. A little bit of damage here on the end of the femur. Partial thickness wear and tear. Nothing too bad. Top of the shin bone okay, and the medial meniscus okay. Coming into the centre of the knee, just behind this ligament, the anterior cruciate ligament, we'll just have a little look at that. Let's move the leg onto the edge. And you can just see behind this ligament, just going to move the... bit myself a bit more pipe so we can see. And there we are. So here we go, just under there. Not showing terribly well, there it is, probably better to see that side. The anterior cruciate ligament, that's normal. Let's take that a little bit out of the way. That's good. And the posterior cruciate ligament just under here. Well, just under there, the fat getting in the way, but the ligament intact, that's good. So back over to the lateral side of the knee. And again, we can see some little osteophytes in the centre of the knee here. But the lateral side in much better condition. A normal lateral meniscus right to the edge, normal tibia, and a normal femur on this side. So the good news is that's looking great. So one side of the knee and right to the back of the knee there. Just bend that knee up. There's the posterior horn of the lateral meniscus, and that looks fine. So there's no evidence of tear. Popliteus muscle in the way, and that's good. So all normal. Take a picture of that. A little bit of synovitis around the back of the knee. See a little bit of inflammation, but nothing major of note. So we'll come back to the kneecap area of your knee now, and this is the worst of the trouble. Lining of the joint there in front of us, the kneecap, tiny bit of damage on the shiny surface on the back of the kneecap, but the worst of it is in the groove of the thigh bone. So here's a little split just there. We'll just trim and tidy up some of that little bit of damage just here. And that kneecap here rubs down this groove of the thigh bone, and that's the main trouble. You can see here, pink bone exposed. This is normal cartilage. This is slightly damaged cartilage, and this pink area here is full thickness down to bone. That's a great big crater. That's bad news, I'm afraid. So what we'll do is we'll take a shaver, we'll do some trimming and tidying, and then we'll do a little microfracture where we drill the little holes in the bone, see if you can grow some cartilage. So I'll come back, show this in a minute. Here we are, starting to debride that damaged area of femoral trochlear. Fairly extensive damage. Good news is the rest of the kneecap's okay, so it's only on one side of the joint. So worth a microfracture technique. If it works, great. If it doesn't, cartilage transplantation or replacement of that area called a patellofemoral replacement. So I'm going to take off those unstable edges. There we are. Looking good. We'll take the curette, thanks. So we're going to put a little curette in the knee. And what this now does is we now take off all that damaged cartilage down to that little pink bone underneath. So you can actually hear that damaged fibrocartilage coming off down to the pink bone underneath. We'll just debride that off. I'll clean that up a bit and we'll show you the bare area that's left. So showing the size of the defect, and I'll show you what normal depth of cartilage you've worn through to get to this bare area. We'll just hoover those little bits away. So you've got nice vertical edges now in that groove. And so if I look there, that's the normal depth of cartilage, and that's the size of the hole. So we'll now do a little microfracture technique. This is where we put a little ice pick type device inside the knee. I'm just going to move back to where I was. And then we're just going to go tap, tap, tap. It'll probably be quite soft actually, Lisa, I imagine. Yep. That's great. So we're drilling little holes in the bone. You can see a little fat coming out that. Yeah. And again. Thanks. So we drill those down, and you can see there's sort of fat and a bit of blood coming out. That with it takes bone marrow cells. Yeah. So the idea is that we'll drill these little holes all the way around, and then in the centre. Yep. Thanks. Yep. So we can get a little bit softer now. I think we're going to the softer bone. There we are. Yep. Perfect. So we'll go around the rim, then in the centre. Just going to hold that there. Thanks. Thanks. One up there. Thank you. And then a bit softer in the middle. Thanks. And again. You can see the fat and bone marrow coming out of the holes when we drill them. And again, not too hard. Once more. That's better. So we can see there those little holes, and we're going to do one just about there. Hang on. Change my hand. Yep. Perfect. So those holes drilled in the bone, one there, one up here, That's it, we've done all those. And then those there, and you can see that fat that's coming out through the holes, and that hopefully in that fat will be bone marrow stem cells. So what I'll show you now is the debriding the loose areas. There we go. So at the moment, that's the new area that we've done. That's the microfracture. And then what we're going to do is we're just going to make another little portal. I'll come back and show you this area in a minute. Let's take a picture of that. Looks quite nice. And here we are, just doing that shiny surface on the back of the kneecap. Bit of debridement there. Partial thickness damage. Nothing too awful. Take a picture of that. So we can see this microfracture area now, and as the fluid comes out of the knee, we'll start seeing hopefully bone marrow cells coming up these holes as the pressure in the knee drops, and then we can see new, hopefully, bone marrow stem cells coming up through some of these little holes that we've drilled. There's the fat starting to come up. Let's get a bit more fluid out of the knee. Sometimes it needs a bit more encouragement. We'll use the hoover to do that. There's the fat coming up, you can see it, there we are. So the pressure is now reduced. Just going to see, trying to occlude our view. So take a bit of fluid out of the knee with that shaver. See the fat coming in. And there we are, bone marrow cells starting to leak into the knee. There we are, up the holes. So that's the microfracture technique, and we'll see whether you can grow some new cartilage.